Today is Stroke Awareness Month, a time to highlight the signs and symptoms of a possible stroke, as well as talk about the importance of getting help immediately. This morning on Ask a Specialist, we'll talk about what you need to know with Angel Eccles, an advanced practice registered nurse at the Queens Medical Center. Aloha and good morning, Angel. Thank you so much for stopping by.
Yeah, thanks for having me.
So this is a very important topic. It can save lives.
Yeah,
First,
absolutely.
What is a stroke?
Okay, so there's a couple different kinds of strokes. I'll kind of break it down into two separate categories. Ischemic stroke is going to be the first one. That is due to a blood blockage in the brain. Okay, so that can happen from a blood clot. That can happen from plaque buildup. Those are kind of the basic reasons why you would have an ischemic stroke. And there's hemorrhagic stroke, which is bleeding in the brain.
Okay, and what are the signs that we should look out for a stroke? Really
important, especially, if you see someone with these kinds of symptoms, this is where you should be concerned that someone's having a stroke. Number one is going to be balance issues. So you're having difficulty walking, you see someone who's off balance, that's something you should think about. Eyes, whether they have vision loss or suddenly their eyes are looking one way or another, that should be concerning. Speech. So new speech changes, whether that be slurred speech or whether that be difficulty speaking, so difficulty speaking or understanding speech. And then time. So time is going to be time to call 911, okay?
Why is it so important to immediately call 911 if you do encounter some of these signs?
There's a lot of things that are really important about calling 911. I really want to drive home that fact. It's important to call 911 as opposed to taking your family member into the hospital. Reason being, number one, emergency stroke care starts in the ambulance. So things that they can do in the EMS is they can start an IV. They alert us in the hospital that you are coming to the hospital with possible stroke symptoms. And in certain cases, they can teleconsult with people who are at Queens Medical Center to see if they need to be bypassed and come directly to Queens Medical Center. There are also certain things that need to be done within a certain amount of time if you're having a stroke. So there is emergent clot-busting medicine that has to be given within 4.5 hours of the stroke symptom onset. And then there's also emergent surgery to remove blood clots in the brain, which has to be done within 24 hours. And then other things, if you are having a bleeding kind of stroke, we need to emergently manage your blood pressure very well, okay? So thinking about those things, that's why it's really important to call 911 as opposed to having your family member bring you in, and then also as opposed to waiting until after 4.5 hours or 24 hours. You don't want to have these stroke symptoms and be waiting 2 days to come to the emergency room.
Yeah, some wonderful resources there.
Yeah.
You can make sure time is of the essence. And to learn more about the services provided by Queens Neuroscience Institute, you can visit www.queens.org. Just click on services, then click on neuroscience, or you can call 808-691-8866. Mahalo for joining us this morning, Angel. Such an important topic.
Yeah.
People out there can hopefully save a life someday.
Absolutely. Thank you so much for having me.